Fab. Hello, everybody. Thank you massively for joining me today, Katrina. So, we're going to be talking about a condition that unfortunately we've both experienced with our dogs called tethered cord or occult tethered cord. We want to raise awareness of this condition because of the difficulty that we both had with our own dogs in getting a diagnosis. So, Katrina, you have set up two Facebook groups. Would you like to just tell people what they're called so that people can find them? And I will link them below in the
Yeah.
notes as well.
So we have two groups. One is kind of a public facing outreach awareness group. It's Dogs with Tethered Cord, I believe, word for word. I think that's what it's called. Um, and that's for anyone that's interested in learning about the condition, vets, trainers, rehab, pet owners, anyone join um, and just listen, ask questions, learn more about the condition. Then for people who have dogs that are diagnosed, we have a second group that's like a support group because it's a difficult condition to live with and kind of just want a safe space to go in and say, hey, this sucks. So that's Dogs with Tethered Cord owner support. It's unsearchable. So you'd have to message me or comment in the main group to find it.
Fabulous. Thank you. And I've used both of these groups, which were part of my research into actually getting the diagnosis with my dog. So, do you want to share a little bit about your story with your own dog? And then I'll also share my story with my own dog so that owners can um, listen to the symptoms and hopefully we will be helping others in getting their dogs diagnosed with this really difficult and not that massively known about condition.
Definitely. So Malice was a Jack Russell Terrier from working sporting lines. So we knew we were getting something a little spicier. Um, but early on, he had some issues with like when it was like a muddy day, he'd come inside, we'd try to wipe his feet. He was a little snarky for a puppy. And we were like, wow, it's just, I guess, terriers. Um, he would chase his tail. And we're like, okay, puppy, it's those are the early signs that in hindsight we're like, wait, that was him showing the tethered cord issues because he would also on we thought it was allergies, but he would sit in bed and chew his back feet a lot. And if we try to stop him, he would again get snarky. At that point, he wasn't actually biting us, but he, toothy and just more than what a puppy should be. Um, and as he aged, he did have some reactivity. He had resource guarding. Again, we're like, it's terrier. But when we got him neutered at 2.5, he suddenly, that was like the spark that started everything. Not that neutering is related, but the way they're on the table
Yeah.
during the procedure, I think that caused a flare up. That was, it just pushed that snowball down the hill. Um, and then once he was neutered, I was like, we can do AKC Fast Cat now. So we started doing that, and that further flared him up. And he started attacking his housemates. He started going after us. Um, we went down the path of because he had some stomach issues,
Yeah.
which now in hindsight, probably pain related. He would wake us up in the middle of the night to go out and eat grass in a panic. Um, so we went down the internist, we did food trials, we checked for Addison's, we got everything cleared there. Um, and at that point he was on a limited diet. He seemed to be a little better, but it kept coming back. So our world got smaller. We started putting up gates in our house, separating the dogs out. He kept gaining more issues. He started chewing his feet more, jumping off the couch, running away, like whipping around, um, biting us more. If we were to, a lot of handling things was his issue. Everything at rest on the couch in the bed was when he would react. Out and about, playing barn hunt happy ratters, I could handle him. And when he was in high drive arousal, I could do whatever. I could take things out of his mouth, not a worry. But then at home on the couch watching TV, it was like everything on edge for him and us. So things kept continuing. We got a behaviorist on board. We saw some improvements with medication, which plot twist, it's because that medication also treats nerve pain in addition to behavior. So we were constantly playing, is it behavior? Is it pain?
Yeah.
And we went to a sports medicine vet, got x-rays. We're told he was orthopedically healthy. We're cleared to do everything we wanted to do. And if we saw the issues persist, to go to a neurologist. So we gave it a little bit of time. We ended up going to a neurologist. She then saw everything, did the MRI, and she was like, he's perfect. Like she walked through the whole, it was a static MRI, of course. She went through the whole thing and was saying, like, just explaining it to me. So I felt like she wasn't blowing it off.
Yeah.
And she wasn't. She was taking it seriously. So she went through and she's like, this is how it should look. And she thought maybe it was a psoas pull, a groin issue. So we went to rehab. So rehab for many, many months. And we saw some improvement, but it's because we added a muscle relaxer to start. Like, wow, it's working. I think we found it. We kept finding it throughout.
Yeah.
And there actually was, I forgot, before we went to the sports medicine thing, we thought he had a zinc deficiency.
Okay.
That was another rabbit hole we went down because we did test him. He was lower on zinc, and that's something after neuter. Sometimes that can cause behavior issues. Maybe a factor, maybe not. Clearly, he had other things going on. Um, so with rehab, we saw an improvement, and then he started declining again when the muscle relaxers were off, and we tried to do normal activity again. So we went to another sports medicine vet who at least pinpointed it was the lumbosacral area. We thought lumbosacral disease at that point. We're like, we got it. We did it. We did shockwave. We saw some improvement for a few months. And then again, it started declining. And that's when I was like, I think we've pinpointed it's back, but we're not managing the pain correctly. So that's when I went to a pain management specialist who finally was like, hey, I think it's tethered cord. Told me about the condition. I found the one blog I could find about Journey, the Kelpie.
Yeah.
No, it's like, yeah, no, this does sound similar. And then we went to Tufts, got the diagnosis, had the surgery. Unfortunately for Malice, he was 5 years old at the time. By the time we got the right treatment, so he had such a long history of dealing with pain and reacting badly. So even though the surgery did help, I think we did make progress there. Any setback, it was too jarring, too unsafe. So we did unfortunately let him go.
Yeah. Which
So
it's soul destroying, isn't it? The years of fighting to try and find out what's wrong with your dog, to then hope that you found a cure, even though it's not necessarily a cure. So, it's lovely that you're, now helping others actually find the diagnosis earlier.
yeah, because I
Yeah,
think if we got it back and when he was just neutered, just reacting, if we could have cut that right there, got him the pain relief he needed, he might still be here.
yeah, yeah.
Um,
So much
but
of your
it's just,
story is
yeah,
the same as mine. So mine is a border collie, and bringing her home from her breeder, she span and tail chased in the little pet carrier that we got between us. I'd taken my dad with me. He had to hold her the whole of the way back because as soon as we put her in the pet carrier, even though it was right between us, span and tail chased, but obsessively so. It wasn't just, a puppy playing with their tail.
yep,
Um, and I can't remember the dates exactly. I would say around 3 months, she started doing these odd kicks with her legs. She could just be standing, doing nothing, and a leg would shoot out behind her. We were like, well, that's not normal. She was actually an aggressive puppy, and I had a lead on her in the house for defensive handling from day one.
Mm.
So it wasn't just puppy biting. She was angry, again, touch sensitive. So as time went by, she was the most genius little dog to train for sport. I wanted to do agility and obedience with her, so obviously we were doing foundation stuff um, up to about a year, and we worked through a lot of the temperament sort of problems. There was a sweet dog in there. And she wasn't biting as much and all of the rest of it, but she was really, really overly reactive to life, quite a lot of the time. But I could see glimmers of some days where she wasn't reactive to those things. But then when she was, it was just off the scale. Um, so it was interesting you said about the neutering as well, because I had her spayed at, I think it was about 18 months. She'd had 2 seasons. Um, and after the spay, she was really, really uncomfortable. Again, putting her in that position for that length of time. Um, she went lame on her right hind for 2 days, and that was what pushed me into getting more diagnostics done. Because up until that point, I was like, there's lots of little vague things that I didn't know who to go to look at the whole dog.
Yep.
So we started the whole, we'll X-ray everything first. Then she went for MRIs. After the MRI, she really struggled to squat to go for a wee for a couple of days. It obviously had really hurt her being in the positions for the MRI. She did have dynamic MRI, but it didn't show what they were thinking. So it was sort of ruled out, but I could still see all of these symptoms. So I joined your group. I watched the blog post about Journey as well. I also joined a human group for tethered cord, which alongside your group really helped me with,
Yeah, I'm in that too. It's
yeah,
it's wild.
yeah. So I was seeing all of these symptoms. Mine had a sacral dimple, the kicking
Mhm.
out of the legs. After the spay, and she then started getting incontinent at night if she'd been in the van for a long period of time during the day. She never had an off switch. It was really difficult to get her to settle during the daytime. But now I can see that actually she couldn't lie down because it hurt.
Yeah.
And in the van, she had to lie down because she was, there. But then that night, she would then be incontinent. She then started getting UTIs, which even though we had them cultured and she had the antibiotics, they still didn't clear up because then we found out she wasn't actually emptying her bladder properly because it was too painful to go to the toilet. So with all of the human group saying about children with UTIs and toilet training problems, and some had gut issues, which my dog always had gut issues as a youngster as well. We'd been through nutritionists, thinking that that was something separate to everything else, even though we all know that gut and behavior can be really linked.
All
Um,
tangled together. It's
it's so
insane.
complex, isn't it?
Hmm.
Yeah. So I kept fighting for a diagnosis, and I went through 8 vets before I found the research paper that was written by Ane Uriate, about occult tethered cord, which isn't shown on MRI. And I was like, my dog has to have this. She listed all of the symptoms that other vets were sort of writing off because they didn't understand them properly. So I managed to get a referral to her. She just understood everything straight away. She operated, and we're now 9 weeks post-surgery. So now we have the other issue of obviously rehab and coming out the other side. Is definitely been worth doing the operation. She can settle during the day now. It's like having a different dog. Um, so we have had blips along the way, which again, I've been really grateful to talk to people in your owners support group, because if I hadn't been prepared for that, I would have thought, oh, it's not worked.
Yeah.
Um, and
And the self-blame that comes with every single setback of like, did I do too much?
yeah,
Did we walk too much? Did I miss a medication? What did I do wrong?
yeah.
But it's kind of inevitable. I think,
Yeah. Yeah.
backs.
And it's really nice to have others that understand it through going through it.
Yeah.
So it is one of those difficult ones, isn't it? Because as we've mentioned, lots of different symptoms that you could put down to, oh, it's just got a sensitive stomach, or, you know, needs some behavioral work. Um, so, and even some of the specialists I saw said "Right, it's behavioral, it's not physical,"
Yeah.
which then is soul destroying when you go, well, why would UTIs and kicking legs be
Hmm.
behavioral?
Yep.
Um, so can you explain what actually tether cord is in sort of layman's terms?
Oh boy. So I always say the spinal cord doesn't move like it should when the dog's living their life. So running, playing, jumping, stretching, all of that causes pain.
Yeah,
And the dog doesn't know what's happening. They just feel pain in their body. So some dogs, softer temperaments, they'll just be, confused, sad, painful. Dogs that are a little bit more spicy, like Malice, he felt that pain behind him. He'd turn around and see another dog and say, "You hurt me."
yeah,
Um, so that's where a lot of the behavior stuff can kind of come in.
yeah,
Um, and it's a slippery slope because when the dog feels the pain in their spine and they don't know what's causing it,
yeah,
whether it be, going to the bathroom, they're like, now that going to the bathroom hurts.
yeah,
That's what's hurting me. For Malice for a bit, because I at one point said, let's go to the dogs, and we were trying to leave the room, and another dog bumped into him. It hurt him.
yeah,
And for months after that, when I said the word go, he would just target the nearest dog because he's like, that's what hurts me. Um, so yeah, I went on a tangent there. But yeah, no, just spinal cord causes pain when they're just living
yeah.
their life.
Yeah.
Um, yeah.
So the operation is to actually detether the
Hmm.
the tether cord so it releases the restriction so that it can move more in the spinal column
Hmm.
as the dog moves. Hence, I presume why my dog can now lie down in a settle with her spine flexed, whereas before she just wanted to be an extension a lot of the time to help alleviate that pain, which is
Hmm.
then makes it very difficult to get the sleep, the rest, that they so much need. Um, so yeah, it's I personally I think you'd probably be the same, was, quite concerned about my dog having a spinal surgery. Um,
Yes. Oh yeah. Well, I remember going into it worried, like, because we were medically managed for 3 months,
yeah,
and you see it in the group constantly of like, my dog's medically managed, they seem fine. Do I need to do the surgery? Because I think they're all picturing, carting their dog out after spinal surgery and thinking they're making their dog worse. But in reality, these dogs are resilient. Malice was pulling me out of the clinic. He got discharged early because he wasn't settling well. So he was supposed to stay 3 days after. I think it was a day and a half after. They were like, "Come get this dog. He's better in your hands." And he waltzed out of that. I'm like, I get a paper cut and I'm on the ground still a day later. Um, so I think that's where a lot of the hesitation comes in,
yeah,
the concern of what if it goes wrong? Am I doing the right thing?
yeah. And there is a risk of retethering, which again is something that I was really weighing up. Was it worth doing an expensive operation, but also, what I see as a big operation to then potentially it not work or come back? So for me, it was a case of, well, actually, I have to do something for the welfare of my dog. Speaking to my vet, she was very much about ideally the dog will be fully grown before the operation, because if they're not and then they keep growing, then there was more chance of retethering. So obviously, my dog was just before she was 2 years old. So that was a, don't like to use the word ideal time, but is there an
Yeah.
ideal time for her to actually have the operation? But something that I came across quite a lot, and I've spoken to several people since writing my blog about our journey, people are being told that their dogs aren't bad enough to have tethered cord. They haven't got enough neurological symptoms. But actually, the sooner that they're seen, treated, operated on, the less, hopefully, damage there will be, permanent damage for the dogs then, and hopefully have a better recovery and chance afterwards. So some dogs aren't being diagnosed until a lot later in life, are they? Um, but also, I think, and this was another really interesting thing I found from the human group, was that actually some people have had babies with that have had the operation. And yet there are people in the group who are 50 years old who have only just had it because they actually haven't had the pain up
Hmm.
until now, which is, again, it's one of those confusing things, isn't it? Because it's not as clear cut as,
Yeah. And like, what's the cause? Is it different degrees of tethering? Is it pain tolerance? Is it something secondary? I don't know.
yeah,
They don't know. No one knows.
no. And I'm beginning to wonder, in the more people that I talk to about the condition, I'm beginning to wonder if dogs actually do have it to different degrees. So therefore, we pick up on the ones that are showing more obvious signs and symptoms. Whereas have other dogs just got some of the symptoms like gut issues or urinary problems, but it's put down to the more common things, which obviously you do need to rule out all of the more common, reasons why they may have these problems beforehand. But actually, how many dogs aren't being diagnosed?
Yeah. Yeah. Because dynamic MRI is the only way to diagnose it. And that's expensive to just dynamic MRI every healthy dog to see how
Yeah,
many of those
but
are
then mine had a
presenting
dynamic
the
MRI and she didn't show because it was a
yeah,
tethered cord,
sure.
which again threw another spanner in the works. Um, so, even with diagnostics, it's not 100% foolproof. Um,
Hmm.
so it is
And
taking,
even looking at the symptoms, because Malice was never incontinent, and that's one of the three things they look for.
yeah,
He was the reverse. He was poop avoidant. We
yeah,
would go outside and you could see he needed to go,
yeah,
and he would do that poop walk that everyone knows. They start getting your bag, and then he would just stop and like look around, almost like he saw a bird or something. And for a long time, I'm like, why are you so distracted? Just do what you need to do. He needed to go. It hurt. He was like, I'm not going to do that.
yeah,
And it got to the point where he would get so stressed anytime we'd go outside to go to the bathroom, he'd then start eating things, acorns, sticks, rocks. He would pick them up. And that's a stress behavior.
yeah,
He was avoiding going to the bathroom. But, and then other dogs, like some don't have as much visible back pain. Like you can't just look at the three main one, like
yeah,
symptoms and say, well, my dog only has this one, so it can't be that.
yeah,
It still could be.
yeah,
There's such a varying degree
yeah,
of the how the symptoms present. It might just be a slight weird move in their gait, and that's it.
yeah.
So,
And it's difficult, isn't it? But I think it is a process of elimination.
mm,
When you see vets going in with, I wrote down all of the symptoms that I could, possibly think about before I had the phone consult first, because I didn't want to forget any of them. And I will link below this video the blog that I wrote about, which has a lot more of Sparkle symptoms in. But she had hair patterns that came up on her back. Again, that could just be a musculoskeletal problem. It doesn't mean that your dog has tethered cord, but that with the sacral dimple, the UTIs, the incontinence, those were the main things which we then, decided to actually go in and operate. So yes, it's not easy, but for anybody who has a dog with these strange lists of symptoms that, trying to piece it all together, I would advise joining Katrina's Facebook group, because there's a whole host of information in there. There's links to research papers, there's people who can talk you through the symptoms that their dogs have. Some have noise sensitivity, which again can be linked to all sorts of different pain conditions. Um, but there's lots of different people, different experiences. But there's also the factual, there's the science behind it as well. And then it is about trying to find a vet that understands the condition. Hopefully that is becoming slowly more known. The more papers that get produced, then the better known it's going to be. But sometimes we do just have to keep going back, like we both did. We both saw a huge number of vets
Mhm.
to actually find the one that really understood the condition.
Yeah.
So, is there anything else that you would like to add to
So
Raven?
with that group, I do encourage people post, comment, don't be shy. We're not gonna bite. Um, if your dog ends up not having tethered cord and has similar symptoms, you find a different diagnosis, I still want to hear about it because that's still valuable information for us because we want to have those conditions on our radar. So come in and chat, whatever.
Yeah.
Or just lurk. I mean, if you just want to read, that is also okay. Um, but the more people that know, the more people that are in there, even if you're just, you're a pet owner somewhere you don't even, you just come and learn about it, talk to your friends about it. That will make a big difference.
Yeah, absolutely. Well, thank you so much for setting up those groups because they definitely helped with me on my journey to getting Sparkles diagnosed. And like I say, they've really helped me post-surgery as well. So I'm a huge fan of your groups and really appreciate you setting them up to help everybody. Like I say, I will post below in the comments the links to Katrina's group and also the blog post about tethered cord. There are some papers linked in there as well for people that want to read more of the science behind it, some of the symptoms, and that from the research point of view, to hopefully help get information out there about this horrible condition.
Definitely.
Okay, thank you ever so much, Katrina, and I hope that anybody who listens to this, helps find diagnosis for their dog.